Oh.
Stuff in the chat.
Sometimes what, Orit?
There's messages in the chat.
Yeah.
Is that something for me to ignore, maybe reference later?
Yes.
You can ignore it. We'll repeat any questions.
Great, thank you.
We usually ask them to hold their questions until the end of your presentation and or put it in the chat if they think they might forget it. So that helps.
Yeah.
All right. We're at 3 screens. Hooray.
It looks like
Really?
Barry
Wow.
Tubberman is from New York. Isn't that a picture of the famous Brooklyn Bridge?
Yeah, but it could just be a wallpaper.
Yeah, we'll find out, won't we?
Yeah.
All right.
Hardly looks like he's from San Francisco. He wouldn't, you know.
All right.
I wanted to ask a question to the group. Am I allowed to do that now?
Can you identify yourself, please? We don't know who's speaking.
Barry,
This is David Bacquis.
Who?
Go ahead.
I wondered if anybody has tried spinal cord stimulation to deal with their neuropathy, because I'm about to get one implanted in me.
Okay, that's a question for later, David, when when we open it to open discussion, okay?
Okay, that's what I needed to know.
Yeah.
Yes, we're going to put the agenda up right now, and we're going to do that begin our meeting as soon as we have it up. Then you can see where the discussion, what time the discussion begins, so you know. All right. Hello, everybody, and welcome. My name is Pat Gualtieri. I'm the president of the Peripheral Neuropathy Support Network. I thank you for joining us today, and we're anticipating a terrific presentation from by Dr. Orit Dahari. We'll introduce her in just a few minutes. I'd like to first welcome back Judson. Judd, you wanted to say a wave there, and Mike Foxworth are working together on our tech issues and keeping us moving. Rebecca will be talking in just a few minutes, introducing Dr. Dahari. And I also wanted you to recognize that Bill Porter, our regular esteemed moderator, is on vacation and was unable to be with us today. He hopefully is on his way back from the Outer Banks, and we will go over the agenda quickly. If you will please mute your laptops and screens. We need to hear silence in the background. Excellent. From 2:05 to 2:15, we're doing our introductory remarks, and then turning it over to Rebecca, our treasurer, who actually has worked with our speaker, Dr. Dahari, and she will be introducing her. We will have the presentation from 2:15 to 3 o'clock, and including some Q&A session. At 3 o'clock, we will break for people to stretch, go to drink, hydrate, and come back together at 3:05. David, this is where the open discussion will begin, and we start with new attendees, people who are first timers at the group. Give you a chance to introduce yourselves, to say a little bit about your PN personal journey, say where you're located. That's always important because of Zoom, where you're from, and then open it to questions like yours about the spinal cord stimulator. And then at 3:50, I will come back in and do a wrap up of upcoming events and webinars that you might want to know about that are happening in the PN community. And at that point also, we'll hear from Glenn Robotsky, who will tell us a little bit more about what Western Neuropathy Association is involved in at this time. And then at 4 o'clock, we will go into what we call overtime. Overtime is sort of more of a social gathering for those who want to stay beyond the official closing at 4 o'clock. It is not recorded, so you might feel more comfortable speaking in overtime than to the larger. We offer that as an option as well. So at this point, I would like to turn the meeting over to Rebecca. And there we go. Rebecca, if you would please welcome and introduce Dr. Dahari.
Hi, folks. Can you hear me?
Yes.
Okay. I met Dr. Dahari. She was doing an intro special at our local Pilates studio, and found out she was a licensed acupuncturist. She's an educator with a background in Chinese medicine, Tai Chi, and rehabilitative Pilates. She's a graduate of Columbia University in New York City. Her passion for mind-body coherence was first ignited during her opera studies in her teens. You'll have to sing for us, Orit. Continued with her Chinese medicine studies at the Virginia University of Integrative Medicine, where she received her doctorate in acupuncture. Orit treats patients with various medical conditions, including insomnia, chronic back and joint pain, and neuropathy. Her acupuncture treatments include nutritional consultation, acoustic therapy, aromatherapy, and movement practices like Tai Chi. Excuse me. She believes that the healing starts from within and that our bodies naturally seek homeostatic balance. Her lecture today will center on how traditional Chinese medicine can give you tools to heal and navigate through the symptoms of peripheral neuropathy. She also is thinking about starting a Tai Chi class, Zoom, I guess, whatever you call it. She can talk about that later if anybody is interested in joining getting Tai Chi instructions. So, Dr. Dahari, hello, how are you today?
Hello, and you can just call me Dr. Orit. That is fine. That's my first name, Orit. So yes, welcome everyone. I'm Dr.
Orit, can you turn your volume up just a tiny bit?
Absolutely, yeah. Let's see. Does that make a difference? Is that better?
Okay, a little bit, yeah.
Yeah. Can
Yes.
everyone hear me today? Rebecca, could it be the volume on your end? Do you want to try and increase your volume as well?
Yeah,
and
no,
see
that's
if-
fine. That's fine.
Okay, great. So I'm a doctor of acupuncture and I'm a licensed acupuncturist and herbalist. And I'm really excited to be here today. Thank you so much for the warm welcome. And today we will talk about Chinese medicine and its various applications to neuropathy. I've treated patients with neuropathy with its various manifestations like paresthesia, tingling, numbness, pain, loss of sensation, loss of balance, and the consequent fear of falling. So we'll talk about that and how Tai Chi and Qigong, which I firmly believe in as something that can help long term as well. We'll talk about that later. And what I have seen in my clinic is that acupuncture and Chinese supplements and herbs can really help alleviate symptoms and restore, thank you, and restore nerve regeneration. So today, my objective is to give you hope via some tools to restore your trust in your body again. Because what I find is that when we lose trust in our body, when we are not sure about our gait, can our legs support us, that really can affect us psychologically as well. And that's why Tai Chi and Qigong can be so helpful. So yes, just to restore a sense of agency in healing your body, helping you see that there are tools that can really assist you. And so in short, to buoy your faith that healing is possible. So in Western biomedical terms, just in case this sounds really kind of esoteric to you, this hope is really the plasticity of your nerves, right? Neuroplasticity. So I believe that healing is possible. And this neurological remodeling that we'll talk about today through acupuncture can really help accelerate nerve regeneration and repair and the remodeling of synaptic transmission. Okay, so yeah, we can go ahead and start the slides if we haven't already. I don't know what you guys can see.
Michael.
Thank you, Mike. And let's move, yeah, we can move to the second slide, please, the next one. Perfect. So this is just an overview of the topics in the presentation. We'll talk about the definition of peripheral neuropathy, its history and philosophy, TCM's key principles, acupuncture, herbs and adjunct modalities, movement, Tai Chi and Qigong, daily tips, and Q&A. And hopefully we'll have time for everything. So yes, let's go ahead and move to the next slide, please. Now, I know that some of this information may be redundant to some of you, but I do think that it's important that we have a baseline understanding of some statistics and anatomy and physiology of peripheral neuropathy, okay? So according to the National Institute of Neurological Disorders and Stroke, an estimated 20 million were neuropathy, and the prevalence increases to 8% in older population. And this number is actually, I believe, higher because peripheral neuropathy can be a manifestation with a wide range of pathologies and symptoms that are left undiagnosed or misdiagnosed. And these findings depend also on the definition of peripheral neuropathy used in the study. So I'm sure most of you know that peripheral neuropathy is by the way, I think someone has their mic on. I don't know, I'm just hearing a little bit of static, but we'll ignore it for now. Yes. Okay, so peripheral neuropathy is a condition that damages the nerves outside the brain and spine, right? And some of the causative and contributing factors of neuropathy include diabetes, alcohol abuse, vitamin deficiencies, autoimmune disorders, smoking, and age. And now the neurons really are help us, our nervous system helps the communication throughout the body, right? And the neurons are like electrical wires that are lined on the outside by special cells that provide insulation. And each neuron has a head called the cell body and a long tail called the axon. Now the synapse is the point where a neuron communicates with another neuron, right? Or an effector cell, like a muscle cell, allowing the transmission of signals. So in peripheral neuropathy, the synapse is affected. And the key word here, I think, is really communication. Like think of the Michelangelo's fresco of the creation of man, right? Where God creates man and they kind of make contact, almost make contact. But in peripheral neuropathy, something goes awry, right, with the communication between the neurons. So there are two main types of synapses. There's electrical synapses, right? Which use gap junctions for direct ion flow. And there's chemical synapses, which release neurotransmitters across a small gap called the synaptic cleft. Now, chemical synapses are more common, and in peripheral neuropathy are primarily affected. And there's a disruption in this chemical communication, right? In which a chemical signal or a neurotransmitter relays information from a nerve to a muscle or a gland. So these are just interesting facts. And just to wrap this little biomed explanation here, think about the longest nerve fibers in the body extend to the hands and feet, right? And they are the most vulnerable. That's why peripheral neuropathy is really experienced mostly in the arms and hands where the ends of nerve fibers are, right? Okay, this is great. Let's go ahead and move to the next slide, please. And I'm going to talk a little bit about motor, sensory, and autonomic nervous system. And the effects of this peripheral nerve damage span all of those nervous systems, motor, sensory, and autonomic nervous systems, with symptoms like tingling, numbness, cold, burning sensations, for example, right? So the motor nervous system symptoms may manifest as muscular weakness and paralysis, muscular atrophy, uncontrolled muscle movements, right? In the sensory, we may experience some numbness, tingling, imbalance, right? We'll talk about how TCM, traditional Chinese medicine, can help with Tai Chi, for example. to help prevent falls and pain. Now, here I think it's important to distinguish between pain from damaged nerves versus pain from healthy nerves, because the key difference is the origin of pain. Neuropathic pain stems from the nerves themselves being damaged or malfunctioning, while healthy nerves transmit signals from the injury or stimulates to the brain. And pain is a big topic, right? Because nobody wants to be in pain. And that's why I want to pause here, and I invite you to contemplate, what is your relationship with pain and discomfort in general, right? So nobody wants to experience pain, for sure. But it may be helpful as a practice to try and suspend, even if for a short while, the need to fix or manage pain, right? Because we're talking about like the toolbox, right? Because I think it can be valuable to dare to question the prevailing cultural idea that we're supposed to be happy and pain-free all the time, right? So instead, consider the value of pain and discomfort. So this is like as a psychological exercise. Think to yourself, like, what is one thing that this discomfort or pain brought to my life that I can be grateful for? I know it sounds funny, right? It sounds funny, but maybe it helped you to slow down in ways that otherwise you wouldn't. Because you slow down, it helped you to intimate with yourself in a different way, right? So kind of expanding our angle. So instead of feeling oppressed or victimized by this, kind of expanding this as a psychological exercise so that we can intimate with the pain a little more. And if you're interested more about this, we can you can ask at the end. There's some authors like Thich Nhat Hanh and Pema Chodron that talk about pain and kind of spin the dialogue so that instead of kind of asking what's the matter with you to what matters to you, right? Right. So that can help us in shifting the dialogue from pain management to pain embodiment, right? So like the concept of accepting pain instead of fixing it, right? And this is really based on scientific rule that nothing changes until it becomes what it is, right? And we can expand on that a little more during the Q&A, but I want to move forward just so autonomic nervous system, we'll see blood pressure changes, hypohidrosis, sweating too much, too little, and then bowel and bladder problems. Bowel and bladder problems, yeah. Okay, so let's move on to the next slide, please, and we'll talk about what is TCM, which is a 5,000 years old ancient system of medicine. And it uses a combination of practices like acupuncture, herbal medicine, moxibustion, nutrition, and massage, so like some manual therapy, and movements like Tai Chi and Qigong to maintain balance and harmony in our system. Okay, you may have heard the concepts of yin and yang or qi, and I'll expand on that a little more in the next slide. But for now, I want you to know that TCM is really a holistic approach that views the body as an interconnected system to restore balance and harmony. Now, what do we mean by holistic? Right, you hear that all the time, holistic. What does it mean? In traditional Chinese medicine, it really means that it draws from nature, right? What's more holistic than nature, right? So to fully glean the meaning of Chinese medicine, one has to understand Chinese philosophy, because both are closely intertwined and they share important intellectual context. And both rely on the natural cycles in nature, right? So for example, Taoism, which you may have heard of, it's a prominent Chinese school of thought, introduces the following concepts of balance and harmony. A central Taoist idea of living in balance with the Tao or the way is mirrored in TCM's goal to achieve equilibrium within the body, to treat the body, mind, and spirit as a cohesive whole, to look at the root cause, like why is this here in the first place, not just to relieve symptoms, which can be amazing to relieve symptoms as well, right? But we want to go a little deeper, right, to the root cause. Another concept is qi, or vital energy. So this is the vital life force that flows through the body and the meridians. And I'm going to talk about the meridians or the pathways in a little bit. So in traditional Chinese medicine, we say that if there is pain, there is stagnation in the qi, in the life force. Something is blocking it, right? And that's why we have pain. Another concept is interconnectedness, like biosystem in nature, the systems in nature that connect and depend on each other, right? Both Taoism and TCM emphasize the interconnectedness of the mind, body, and spirit. And that's why I introduced the idea of, as a psychological guide, inquire and contemplate, what is your relationship with pain in general, right? Do you get angry, fearful, victimized? And all of those reactions are totally fine and normal, but just notice that for yourself. And then finally, harmony with nature. This Taoist principle extols living in accordance with natural rhythms, right? So think of circadian rhythms, regulating our bodies, eating regular meals, eating healthy meals, right? Regulating our emotions. These all have effects. Maybe you'll notice that when you're really angry, your symptoms are much worse, just for example, right? Or when you haven't slept well, then your symptoms are worse too, because there is something that's disrupting the regular flow of qi. Okay, good. Let's go ahead and move to the next slide, please. I tapped into some of the key principles, and I'm going to expand a little bit more about yin and yang. So as you see at the center of this diagram here, there's what we call the Wu Ji. So there's yin and yang, which promote regulation, balance, and moderation between the dichotomies. So they represent light and dark, hot and cold, action and non-action. It's all about the balance. And there's not just this or just that. So you see in the black section, there's a white dot, and in the white section, there's a black dot, right? So we're looking for that interconnectedness because life is a state of constant flux, right? So how can we come back to harmony? It's not static, it's always in flux. And it's about having that skill of, how can I balance this? Yeah. So qi, we talked about qi as this ineffable force, life energy. And also there is the concept of 5 elements, which are drawing from nature again. So there's 2 fundamental cycles of the 5 element, for example, and you can see them here. You see fire. Actually, you cannot see my cursor, but you see how around the Wuji, there's the fire, water, there's a mistake there, but anyway, there's fire, you see all the elements, right? You see the elements, yeah? And so there is a cycle that relates to the generating cycle, and it represents growth and regeneration and balance promotion of one element to the next. So there's fire, for example, right? Fire creates earth, like ash. Earth creates metal, and metal generates water through condensation, and water nurtures wood, and wood fuels fire again. So part of our this can be a diagnostic tool. Some person may have a lot of fire in their body, and their eyes are bloodshot, and their face is red, just like fire is rising up, right? So how can we calm that? What element is out of balance, right? And I understand that this discussion may be new to some of you, right? But this is, if you're in doubt, just look at nature, right? Look at nature and look how it always looks to balance itself, right? All of these principles really draw from nature. So for example, in TCM, just adding to this, diagnosis in TCM, we look at the diagnosis of neuropathy as the root cause being as either blockages or deficiency. There's some lack of nourishment. There's some something is disrupting the blood flow, right? So let's go ahead and let me see. Let's go ahead and move on to the next slide, because I know a lot of you are eager to hear about acupuncture. So I know that some of you have experienced acupuncture in the past. Maybe during the Q&A, it will be interesting for you to share some of that if there's time for this. But let's revisit the modalities of TCM. Yeah, so acupuncture, it's a Chinese medicine technique that treats chronic pain, muscle pain, GI disorders, insomnia, allergies, peripheral neuropathy, vision, hearing, right? It's based on the meridians, which are invisible pathways, right? Invisible pathways that run throughout the body, and they carry chi, or vital energy. So notice that I'm using the same terms. That's why it was important for me to set up the vocabulary early on, right? So it involves the insertion of thin pins, the size of like the thickness of a cat's whisker, so very, very thin, on the body in specific points to promote healing and balance and stimulate blood flow and activate the natural immune response. So interestingly, there's a correspondence actually between neuroanatomical and neurological pathways and the meridians, right? So the ancient Chinese, they knew what they were doing. So for example, along the nerve pathways, there's acupuncture points that actually coincide with nerve endings, suggesting a connection to the nervous system. Lymphatic vessels. The lymphatic system plays a role in transporting fluids and immune cells, which may be related to the flow of qi in the meridians, right? We talk about that blockage. Sometimes there is blockage. So we're looking to release that blockage. And then connective tissue. Fascia, which is a network of connective tissue, could potentially serve as a substrate of meridians, right? This is all very interesting. So we see that acupuncture can help via one, modulation of pain pathways. It stimulates the release of endorphins, the body's natural painkillers, and other neurotransmitters that reduce pain perception, right? All in a non-invasive way. Two, it can help with the improvement of nerve conduction. It stimulates nerve regeneration and conduction to reduce numbness, tingling, and burning sensations. And then finally, it reduces inflammation, right? These are just some examples. So I will add, though, that at the clinic, when I work with patients with peripheral neuropathy, I consider both, one, nerve entrapment, and two, vascular issues. So patients with numbness, for example, on the bottom of the foot, I find that often they have extremely tight plantar flexors. Those are the muscles that you use to point the foot, right? So there's a correlation here. So these can cause, for example, tarsal tunnel syndrome, which is the compression or pinching of the tibial nerve in the foot, and causes symptoms like pain, burning, numbness, tingling in the ankle, heel, foot, and toes. And then they also may have some ischemia, like kind of ischemic toe flexors. Ischemia being a condition where there is a reduced blood flow to a specific area of the body, right? So it results in lack of oxygen and nutrients. So in other words, I think that, and we'll talk about this at the end about daily tips for helping the circulation, because I think there's definitely a correspondence there again between vascular issues and nerve entrapment. And that's where I think that there's so much that you can do, because if you have tight muscles, I always say that's the good news, right? That's the good news, because there's something you can do about it. You can massage it. You can get some manual therapy around that. You can breathe into that. You can relax your mind, because when the mind is tight, the body gets tight, right? There's a connection here, right? Normally, when we get tight, our shoulders, everything lifts, our breath, right? We activate the sympathetic nervous system, the fight or flight, instead of the parasympathetic nervous system, which is rest and digest, right? So there's a relationship there. Okay. Let's go ahead and move to the next slide, please. So Tibetan food soaks, nutrition. There's the mixture of herbs and minerals in Tibetan food soaks address pain. So the sheer act of submerging your feet in warm, hot water, right, warms your feet, aids in relaxing the fascia, and dilates the vasculature in your feet and lower legs, right? So this is something that you can do as well. There's also other adjunct modalities in acupuncture. For example, cupping. I don't know if you guys are familiar with cupping, but it's a tool that has its lineage in Chinese medicine as well. It involves the placing of suction cups on the skin to create a vacuum. or negative pressure that draws blood to the targeted area and helps lift and separate the fascial layer. So it helps with muscular adhesions, with fascial adhesions. So again, if you have someone who has very tight plantar flexors or any part of the body, back, lower back, and I find that often there's tightness in the lower back when there's numbness in the feet, then cupping can be great for that. And this particular mechanism of reverse negative vacuuming helps, enhances blood flow. It delivers oxygen and nutrients to the targeted area, promotes lymphatic mobility, facilitates the reduction of fascial densification or adhesions, and it helps with the removal of metabolic waste. So it really has a lot of good effects. We also have eStim or nerve reboot, which promotes nerve regeneration and reduces pain via direct stimulation. And there's mox. I did not include that in the slide, but moxibustion is a form of heat therapy, right? It's the burning of mugwort or aye in Chinese. So it increases the temperature in a particular area and creates vasodilation. So the warming properties of moxa make it a brilliant therapy for peripheral neuropathy when it's appropriate. Okay, let's move to the next slide, please. We're almost at the end here. So we're going to talk about a little bit about Tai Chi. And I encourage you guys to, oh, okay, this was oh, hold on, right there, sorry. This is the cupping, right? So just in case you haven't experienced it before. So there's different ways of doing this. There's the vacuum, the cupping can be done with a vacuum, not with a vacuum, with a pump rather. And I normally in my clinic, I use fire cupping. So it's a really cool, it's, yeah, it's a really cool effect, and it feels like someone just kind of suctions your skin upward with the muscle, and so it kind of lifts the muscle off of the bone, and long term it can really help with relieving tension in the area, and it's very relaxing. It has like this a nice analgesic effect. Okay, so let's go to the next slide, please. And we'll talk briefly about Tai Chi. So I encourage you all to do your research about Tai Chi and Qigong. Maybe you'll find someone in your area. If you want to do in person, I'll talk a little bit about a 4-week Tai Chi series that I'm going to offer, focus on neuropathic patients, particularly. So we'll do exercises and that involve like massaging, specific areas that tend to get tight, just again, give you tools, because it's really at the end of the day, it's all about tools, right? So there's a little quote here. Tai Chi is known to activate the neuromuscular systems and helps improve balance and postural control. It helps patients with neuropathy restoration. Every step feels like we're taking a risk. We don't want that feeling, right? So it increases proprioception, right? Where is my body in space? Where I'm in space? Am I in space? Even when I close my eyes, where am I, right? That's our proprioception. And increases muscle strength, improves gait, and tactile sensitivity. So quote here is from the Foundation for Peripheral Neuropathy. I think that says it all, right? So explore Tai Chi and Qigong. It helps in improving balance, yeah, etc., etc. Okay, let's move on to the next and final slide here, or penultimate slide. Daily tips. So many of us spend our days walking in confined shoes. You're losing a bit of Orit's audio. Can you hear me? No? Rebecca, can you hear me?
Yes, it's just fading out a little
Yeah?
bit. I just want people to know that,
Okay, maybe I'm talking,
yeah,
okay, maybe I'm
it's
talking too
good.
fast. I can
It's
slow
good.
down. Okay, good, Tim. So as I was saying, that so many of us spend most of our days in confined shoes, right? And we do what? We walk on flat surfaces. Now look at this little, I included this image intentionally, right? You see how many bones the feet have? You see all these little bones? Anyone knows how many bones we have in our feet? Take a guess. A quick estimate.
25.
Okay, close. 26 bones. Very close. Yes, good. Now, why would we have so many bones in our feet? Because they're meant to be dexterous, right? They're not meant to be like that, right? There's a lot of undulation and articulation in our feet, in our feet. So that's why my first step is to try and stand or walk barefoot on uneven surfaces, safely, of course, right? Especially if you feel like your balance is off kilter. So our feet are meant to move on uneven surfaces, right? So if you feel uncomfortable walking, you can even use a ball, a massage ball, or even a rod, just something to open the feet, right? Open the fascia, let your feet articulate. It can be a sensory practice as well. If you have smooth, odd-shaped stones, you can just stand on them, hold on to something, and have that as a sensory experience, right? So I call it like dialoguing with the earth in order to restore fascial integration, right? So yes, I talked about reducing muscular tightness with self-massage. This is something that you can do on your own. You can find a manual therapist in your area. Explore improving circulation with Tibetan foot soaks, right? Even just submerging your feet in warm water, practicing Tai Chi or Qigong, kind of finding a disciplined, ritualized time for yourself where you connect with your breath, connect with your experience, connect with your pain and the discomfort, right? And cultivate that kind of awareness. And then finally, I did not include that, but yes, exploring your relationship with pain, which I think is also interesting, and can be helpful. All right, and then final slide, please. Yes, so here's a little information about my upcoming 4-week Tai Chi series for neuropathy. It's going to be on Zoom only. Physically, I'm located in Westchester, New York. I don't know if there's anyone here from Westchester, New York. If you are here, you're welcome to visit. I normally offer complimentary acupuncture and herbal consult, and of course, I can also do that remotely. And in terms of the Tai Chi series, I encourage you all to join, or at least do your research. If you're skeptical, do your research, right? And see how you can bring some movement into your holistic treatment plan within yourself. Yeah, so I think that's it on my end. We'll open it up to any questions. I hope that I can answer some of them, and if I don't, we can follow up later. If we don't have enough time, feel free to reach out to me directly, and we'll take it from there. Okay.
Thank you.
Yes, you're welcome. Thank you.
Thank you very much.
All. My pleasure. Thank you. Thank you. Mm-hmm.
After, if it will help,
I have a question.
Mm-hmm.
nerves from
Uh,
stroke.
Huh?
I have a
Can
question.
All right, I think there's few of you have questions. So, yeah.
Go ahead, Judson. Why don't you start?
Okay. I had a stroke 3 months ago, and I know that's nerve related. And I wonder if acupuncture would be uh, advisable for, that disease, or just generally nerve conditions such as people with bad knees or shoulders or things like that.
Yeah, I think with stroke recovery, acupuncture can definitely help because it can help improve neurological function,
Mhm.
right? It can also be combined, with conventional therapies as well. So you can always, of course, consult with your PCP and cardiologist. Yes, yes. I mean, I'm not sure. When you find a practitioner, an acupuncturist, you can talk to them more in depth about your concerns. But for sure, yeah.
Okay, Chuck Barnhart has a question.
I just want
yeah.
to mention to the group that I've had success on several occasions with acupuncture relative to the burning in my feet. That helped that a lot. And I'm going most recently for some eye issues that I have or had. I over this late summer, I had double vision unrelated to acupuncture. I mean, unrelated to PN. But that's getting better. In fact, it's gone. My double vision is much improved, but I started with the acupuncturist 2 weeks ago for treatment of that double vision. And dare I say, it was successful, and it started to be successful. And I have a question about concussion. Can acupuncture help a concussion issue? Because I have a good friend, a young friend, who got a concussion while serving in the Navy in Florida. He was medically discharged.
I personally, I don't have experience with concussion patients, so I don't know what are his symptoms. So much. Mhm.
He I don't know what to say. He's just not himself. You know, he has a what do you call it kind of dog. He has a comfort dog, as a matter of fact. And I'm surmising it's related to the concussion.
So he has a what?
A comfort dog. I surmise he has some anxiety.
Oh yes, acupuncture is great for anxiety. Okay, yes. I think acupuncture is great for anxiety, depression, any mental disorders, because it can help regulate our nervous system,
Right.
right?
Right.
Yes, yes.
Okay.
Mhm.
You know, I have another friend.
Orit, a comfort dog is like a service dog. It
Oh, a
helps
comfort
the
service.
person
Right. Comfort
that's
dog.
got it.
Uh-huh.
I think I froze up again. Here we go. Oh dear.
We can hear you.
No, yeah, we can hear you. Yeah, we can hear you.
Oh, you can? Okay, sorry. And Chuck actually was the one that we communicated, and he's the one that said, "Hey, go get acupuncture." So he's one of the reasons I decided to start coming in to see you. So
That is so great. And Rebecca, I know you and I had the discussion of so many people try acupuncture once or twice and then like, oh, it doesn't work. And that's it.
yeah,
And I always use going to the gym as an analogy, like going once or twice or three times. Oh, it didn't work. But so much of it is about commitment, right? It's about relationships. It's about being committed to your self-care. So when you find a practitioner that you resonate with, sit down with them, and then they'll create a treatment plan for you, depending on your symptoms, how acute, chronic is your condition. And then it's about the longevity of the practice. So there's a phase in which we try to just kind of focus on symptomatic relief, and after that it's about stabilizing the symptoms and then maintenance, right? So it's a lifelong commitment, and of course there's improvement in the symptoms, right? There's a lot of evidence that shows that.
yeah, I know when I started, just FYI for everyone, I had horrible leg cramps at night when I was sleeping. And after a few acupunctures, that started going away. And then Ori started working on other things with me. So, and Miss Betty Ann has her hand up for a question. And you're muted, Betty. So unmute.
How do you do that?
Thanks. I just wondered, is there a way to find somebody who is trained in the same method as you are in the Rochester area? I have had acupuncture for about 8 weeks, and after that, she said, "I don't think this is working." So I stopped.
Particularly for neuropathy.
It's idiopathic, yes, from my knees to my toes.
Oh, interesting. So Rochester, New York.
Correct.
Yeah, we're a little far. I'm in Westchester. I think we're
Right.
like 3 hours away. That's a good question. I think so much of it is you'll have to do research. That's
Okay.
yeah. But let me think about that. I don't think you can reach out to me later directly, and if I can think of anyone, I'll let you know, okay?
Betty Ann, her email address is in the chat, so you can.
Oh yes, thank you for that.
Okay,
Yeah.
thank
Yeah.
you.
And if you guys share the slides with everyone, do you normally
Yes.
share yeah, the
Yes.
PowerPoints? Okay, great. So my information is in the final slide as well, and my website is there as well. Yeah.
Friends, to restore some order and not have people talking over each other, please wait to be called on. I think Marlene had her hand up, and then John Wright.
All righty. I can't get back to the screen now.
We see you though.
There you are, your pretty face. Yeah, I'll make this quick. In addition to the loss of sensation and numbness, I have the fat pad atrophy pretty bad. And this is really affecting my balance, and I'm very dizzy and fatigued from this all the time, because when I'm walking, I have to be so careful not to fall. I haven't been to acupuncture. I went years ago when it was in my arm, but now I think I'm going to try it again because nothing else is working. Creams, lotions, soaps, nothing has helped right now. So I do want to try that. You talked about prescribed formulas. Can you touch on that?
For the foot soaks.
Yeah, for sure. So these are some of these products you can actually purchase online. They're very expensive. Some of these Tibetan foot soaks can be really expensive. I sell them as well, but I like my rate is like half of what they are sold for online. But so much of it is also customized, right? So there are liniments that you can use in terms of internal herbs. That's like I sit with the patient and I just see what do they need. So often it may include like herbs that help in improving blood circulation and help reduce inflammation. But from there on, it really depends on the constitution of the patient and what they need, right? So it's very individual in that sense. But I know you mentioned fat pad atrophy, and acupuncture can be great for that because it can help in improving local blood flow and reduce inflammation. So I encourage you to, yeah, I encourage you to check it out.
I'm going to try this. I'm calling next week. Yeah,
Okay.
thank you. Thank you.
Orit, is there a national association, a directory, something that would help people find a like-minded acupuncturist, or do you have any suggestions like in Rochester? Is there a way for her to research it herself?
Yeah, there is. Let me get back to you on that, okay? I will send you some resources.
And we will be putting her slideshow up, but it will take a couple of weeks. Don't expect it tomorrow, okay? But John Rice, excuse me, you had your hand up. Do you still have a question?
Yes. First of all, thank you for sharing all the information about acupuncture. I live south of Boston, so perhaps that might be something I will pursue in the future. My question that was at the top of my mind had to do with the effects of exercise in general on peripheral neuropathy. My situation is idiopathic. I've been told that perhaps I could have some unknown variant of Charcot-Marie tooth disease, but the tests have come back inconclusive, so I'm not really sure exactly what's the cause of my peripheral neuropathy. Like I said, I enjoy exercising, and in particular resistance training. And I was wondering if perhaps there's a link between resistance training and the benefits of is it Qigong, or I have a hard time pronouncing that.
Yeah, you did.
Oh, okay. I wanted to know if you think resistance training can have a direct benefit, like almost immediate, on the effects of my peripheral neuropathy. Like I can go for like 2 or 3 days where my neuropathy is really troubling me. It's like electrical in my legs, and I'm experiencing muscle twitching and tingling and all of that. And then I notice when I do my resistance training, it's almost like I realize, wow, I'm feeling a lot better now. And that may carry into like the next 24 hours or thereabouts. And sometimes I wonder, it's like, okay, is this in my head? Or what is this a mental thing that, just because of the endorphins, or is it more anatomical as it might relate to increased blood flow or something like that?
Yeah, I think you made great observations. I think it could be like kind of a collective of all of these, the endorphins, the increased circulation, with you said like, so what kind of training you like? Like low impact?
Strength training. I do squats and lunges and leg extensions, leg curls.
Yeah.
I try to challenge myself as intensely as I can because I'm trying to combat the muscle wasting. So it's pretty rigorous, but I do feel as though it helps me at least in the short term, on that day for the reasons I described. And generally it may go for 24 to 48 hours, like, wow, I feel better. And then like this, it's like the symptoms start to creep back again thereafter.
Yeah. Well, I think that's great that you found something that can help. And I would also recommend like trying isometric contractions. So for example, Pilates, because Rebecca and I met originally in Pilates. So Pilates involves a lot of isometric contractions. So that can be something that to consider, right?
Right.
So
Okay.
as long as your exercise is safe, because especially if you feel like you're not stable, then you may want to kind of modify it. Um, but
But do you think increased blood flow would be the best explanation for the improvement in how I feel?
I think that's part of it. I'm not sure. Do you also stretch? I mean, if there's some muscular tightness and you stretch, right, that can also help with any vascular issues,
Right.
right?
Okay. Yeah. I do a dynamic warm up before, not so
Yeah.
much after.
Yeah, breathing, you're increasing oxygen when you
Right.
exercise, right? So a
So
lot of
so I guess that a message to everyone listening, perhaps, don't forget about the values of exercise as it relates to your neuropathy, and
yeah,
it definitely helps me. I
yeah.
just wish it would help me forever and not just for 24 to 36 hours.
That is so true. So much of it is relational. Because I believe that healing is possible, but healing is spontaneous. I don't know if any of you, if you're familiar with Dr. Andrew Weil. So he
Yeah.
wrote a book called Spontaneous Healing. A big advocate of his teachings. So like my experience of healing is that of course healing is possible, but often healing also happens on its own time. We can't fix it. We can create the conditions for healing, but we can be like, okay, I want all of these to heal by tomorrow at 2 p.m. Right? Because it doesn't work that way. We can't will ourselves into healing. We can create the conditions, and that's why self-care is so important. And it's a relationships, it's a daily relationship because we are relating to the earth every day. We're relating to our environment every day, to our bodies. So, and that's a good thing.
That's
Yeah.
right.
Can I make a comment here? For John and for everybody, actually. I saw a physical therapist a few years ago after I had a nasty fall, and she recommended, and I do it to this day. In the morning, I do some stretches before I even get out of bed. I do what's called an S twist, where you bend your knees and you twist your knees over to one side, that stretches out your back. And then the other side, I stick my legs up in the air and point and flex my feet. And that kind of wakes everything up in your legs to when you get out of bed. It helps me a lot anyway. So you might try that, John.
Okay, thank you.
Thank you, John. Ann Stillwell has put a message in the chat. I've had great success with the combination of acupuncture, chiropractic, massage, and B12 shots. Ann, would you like to tell us more?
Sure. I'm I'm in here. I'm in the group from Reno, Nevada. So I am far away from where you folks are. So Yeah, my neuropathy started when I was around 30 years old. I think it started after I fell off a horse and my lower back was injured. And but my dad died when he died at 90 years old. He was numb all the way up to above his knees. And so I think I have a familial tendency to neuropathy. But anyway, I have been doing chiropractic since 1979. And then when I moved to Reno, I got started with acupuncture and B12 shots. And I go to the gym regularly. And I'll tell you what, my feet are 100% better now. There's no more burning. There's no more throbbing. There, I can walk barefoot across a cement floor. My balance is way better, but I'm physically fit, much better physically fit. I've lost some weight. So the combination of all the therapies is what I highly recommend. One or the other, everything works in combination. As you know, your bodies are a whole body, not just parts of the body. So anyway, that it really, I highly recommend that. If you can manage it, get combined therapies, not just one or the other, but you have to stick with it. I'll tell you, you can't just quit. You've got to, it's a maintenance program. You have to go on a maintenance program because somehow your body's injured and it will heal, but it takes a long time to heal. So it's not going to happen in a year or a year and a half or 24 months. It's going to take a while. That's my recommendation. That's what's worked for me.
Thank you, Anne. I can't believe it, but it's almost 3 o'clock and Dr. Orit needs to leave at 3 and we're scheduled to take our break for hydration and stretching at 3 o'clock. But Pam had one last question, Pam, about your mom and the burning in your the rest of your body. Are you there, Pam? I don't know how to say her last name, Hagasawa.
Hi, sorry. I typed it in for my mom. My mom is Pam, and I'm the one who had the question for my mom.
Okay.
So, Mom.
Yeah,
That's you.
that's me. Okay. About prenatal stuff, right?
No, the burning in your eyes, and then if it's all sort of related, that's what we're reading, that peripheral neuropathy can also cause burning in other parts of your body.
My eyes burn a lot, and I was so interested that somebody mentioned having double vision and getting through that. That's crept up on me in the last few months. And I'm just wondering everywhere I read about any ailment that I'm dealing with, I see diabetes mentioned as a correlate of what I'm experiencing. And did I get my question out?
Well, yeah, I think I can understand. Yeah. So I think acupuncture can help. I'm not sure what's the cause of you said redness in the eyes. I don't know if there's
No, burning.
Burning.
My eyes feel hot and dry most of the time. And in the last few months, the double vision has become more problematic.
Right. So with acupuncture, it can help in increasing tear production and reduce ocular inflammation. So this is something that you may want to consider. But yeah, make sure you check with your doctor, with your eye doctor as well. Make sure your eyes are healthy. That's really important as well. So someone mentioned the importance of combined therapies, right? And we're not excluding any type of modality. I think it's really important to combine them all and to be really informed about your healing journey.
Our last question, actually, Dr. Orit, is your Tai Chi class free of charge or is there a price? And does insurance cover any of this?
Oh, good question. Yes, there's a fee, there's an early bird rate. So if you contact me, I'll send you all this information. I try to make it accessible to everyone. So if you have any financial difficulty, let me know. I would want you to experience it regardless. So don't let that be something that hinders you from joining the group. And we can do like, we're going to do a 4-week kind of trial period, see what the response is like. And then if there's more interest, we can do an ongoing thing. Because my idea, just to kind of bookend from the beginning, my hope is to really give you hope, right? So that there are tools that can help you feel like you do have agency and kind of strengthen your commitment to your self-care.
Excellent. And we will be putting up her contact information again while we're on break, so you can refer to it, and it will be on our website with the recording information at a later point. And the last part was the insurance coverage. Is acupuncture covered at all?
Yeah, many people work with, many practitioners do work with insurance. I personally am out of network, so I do not work with insurance. But this is something that you will need to check with your practitioner, with your acupuncturist, that is.
I have one more question.
Michael, quickly.
Can you do Tai Chi sitting down?
Yes, absolutely. You can do Tai Chi sitting down for sure. And that's why I encourage you all to participate in this, because no one will be excluded. And it's really about adapting it, yeah, to where you are.
So if we went to your class, we could learn what the proper techniques are for doing it, even though we can't stand. We could still learn the right techniques by sitting down.
Absolutely. Yes. There's things that you can do sitting down. I don't know if you can stand at all, like even holding on to a chair. If that's not accessible for you either, then we can talk about modifications. Yeah.
Excellent. Thank you so much, Dr. Orit. We've learned an amazing amount of information, and a round of applause. And we are going to take our usual 5-minute break. Please come back about 3:07 now. Hydrate, move around, stretch, and we'll see you in a few minutes. Thank you.
You all. Bye.
Judd, can we pull up her contact information and post it in chat? Is that possible?
Mike can't. Well, of course,
Okay.
but Mike has the slides.
Oh,
So
that's right. Sorry, Mike. Could you do it?
Uh-huh.
All righty. I thought it was excellent. I'm very pleased.
good.
It's very good.
Wish we had more time for questions, always.
Pat,
Yes.
are you there?
I am.
I just looked up, I just Googled acupuncture, if Medicare covered it. For back pain, it said it covers up to 12 treatments.
Oh, wow. Okay.
I didn't know that.
I didn't either. I can't imagine any of us don't have back pain. Legitimate.
Yeah, I think specifically you have to go in with that would be the first, thing. But it said it does cover Medicare, but yeah.
Well, thank you for checking that. That's excellent. Of course, you have to find a practitioner that accepts Medicare, and it sounds like
That's
maybe
true.
Dr.
But
Orit.
I think I found one right near where I live. I was looking, and this person had great reviews and works with neuropathy, so I'm going to try it.
Oh, wow. Maybe when we come back, you could say how you did that research. I mean, how did you find that person? Because I think some people say research, oh, they just Google it, and they don't know how to find the reviews. They don't how.
Oh no, I'm an expert Googler. I do it for all my friends too. They call me because they know I'm pretty thorough.
Good. Okay. I'm going to take my own advice and go get some water.
Me too. I think I will too. I'll come back. All right.
We'll be back in a couple minutes.
And you got my message about Dr. Levine, right?
Yes, I answered you because you
okay. How did I miss that? All right.
You sent it a while ago, and you said, "Can I reference you?" And I said, "Absolutely."
I can't remember. The last message was that I'm going to see him in November.
Yes, I have answered that one, saying use my name, of course, and remind him of the B12 that has really been something that he personally had recommended that no one else had ever even mentioned to me. So
All right.
I think he's really good. He listens. He spends a lot of time. I'm so happy you got to get an appointment with him.
Oh, well, yeah, after the cancellation thing, I was so disappointed, and I must have sounded desperate.
Well, I've been told by several people that he isn't accepting anyone new until for at least 6 months. So you were lucky to get the cancellation, and I'm happy.
Yeah, well, I did get lucky because someone I found before that canceled on me twice in a row after I waited months, and then this happened, and I thought I was like at wit's end with this, finding someone. So I'm happy. I can wait till November. Yeah.
Yeah, excellent. And
all right, go get your water. I'm going to do the same. All right.
I'm taking a picture of this. And Glenn, we're going to go over at the wrap up the not the situation, but the dates for Bethesda Chevy Chase. And I'm going to turn to you, as I always do, for you to say whatever new information you want to share about Western neuropathy. And I'm going to mention the September webinar on Bowen. Is that how you say it? Bowen,
Yes.
Bowen therapy, and that the recording is available, because I thought that sort of is an adjunct to what she's been talking about.
Mhm.
So
Yeah.
that's a possibility. And then FPN's webinar later in October about regaining your balance. And if there's anything else, please add that I haven't thought of. Okay?
Yeah.
Good. I'm going to get water.
Yeah, I don't think you know me very well. This is Meredith McNabb, but I just think it's remarkable you're back here so soon.
You talking to me?
I think it's fabulous that you've come back so soon. It's really remarkable.
Oh, well, God bless you and God bless in general. I appreciate what you're saying. At first they said it was a minor stroke, and then they kept saying, well, no, you've had a stroke. But I was happy to report that it seems to have affected my medulla, the autonomic sections of my body. So I can't walk. I'm in a wheelchair.
Okay.
But my cognitive functions are no better or worse than they were before. And so I'm really grateful for that.
And you're speaking real well too, so none of that's impacted.
Yeah, I've been cleared by the speech therapist. And
yeah.
So, but it's always, stroke is real serious, and I'm in PT, and I would consider myself in rehab.
I have it down 11.
Yeah.
Yeah.
Well, you get a lot back in the first year, whatever. The first year is pretty critical.
Right. That's what
I
they
went through
say.
that with my dad had a full-blown stroke later in life. And so, we did all that sit and be fit and PT and OT and all of that. And he really got a significant amount back.
Good.
So I know that first year is pretty critical.
Yeah, I'm trying to put my back into it.
You might want to try that Tai Chi if you can do sitting down. There are online classes. Maybe you can find an online class and do it. The point is to try and even mentally doing it. I understand. Even just trying mentally, even if your body doesn't quite respond, can help.
Yeah, I get you. I heard that. Sit down Tai Chi sounds pretty attractive to me at this point.
Yeah, I gave up on Tai Chi because I couldn't keep my balance. But it didn't occur to me until I was listening to her, it didn't occur to me that I could have tried to keep it up using just sitting down. The point is that say you try to hold a position for a little bit. That just holding the position involves a lot of feedback to your head.
Yeah.
My problem with it was memory. I could not remember the steps. And he would introduce it, and I told Dr. Orit that he had had a stroke himself and was a little hard to understand, compounded by my hearing and my brain. It didn't work for me. So I would like to try this with her online and see. And I've done chair yoga for years. So that's, as someone suggested, David, I think it was, that's another option that we don't often think about. All right, everyone, I'd like to welcome people back. It's our 5-minute break is over, and we're transitioning to a new section of our meeting where we introduce new attendees and have open discussion. Judd had just put up, or Mike had just put up, sorry, Dr. Orit's contact information. If you could put that back up, Mike, for a minute, if you still have it available. Because people can take a picture of the contact information while you're waiting for us to post it on our website. And it tells you the dates for her Tai Chi series. And I think that might be useful. Okay. We're now going to go to a chance for our new attendees, those who have never been to one of our meetings before, to give them the first chance to speak. And then after they've had an opportunity to talk a little bit about their personal journey, please tell us where you're located, the type of neuropathy you have, how long you've had it, and anything else you would like to share or question or concern you'd like to raise to the group. And so if you're new, please raise your hand so we can see you and know that you would like to share something.
And Pat, maybe we can take down the slide. Yeah,
for sure. I think we probably have had it up long enough. Thank you, Mike.
Just a second. I'm putting it in the chat.
Lovely.
Also, people, if you would raise your hand on your video, that way you move kind of to the top of the list and we can see you better.
Sure.
If you're just waving your hand, sometimes we miss that.
Absolutely. Okay, is there someone who is new this month who would like to speak to the group? I know David is new. Would you like to share, David?
Thank you. Yeah, I'm relatively new. I live in Durwood, north of Rockville, but I've lived all over Montgomery County, Bethesda, Chevy Chase, and other areas. I have diabetic peripheral neuropathy that I experience primarily in my feet, although there's symptoms in my hands too. It feels like somebody's hammering a nail into my toe and bees are stinging my toes. It's not gentle tingling. And I've tried about 6 different oral medications that didn't help, which pushed me into the category of a spinal cord stimulator. And I'm wondering if anybody has had experience with that.
Anyone here would like to share their experience with a spinal cord stimulator?
I've had none. I didn't have it.
Betty Ann?
Betty Ann.
Betty Ann.
Unmute, Betty.
There she is.
Okay, I tried the spinal cord stimulator. We did it for a week and it did absolutely nothing, but mine is idiopathic. So they're telling me no cause, no cure. I've tried everything known to man.
Oh my.
I'm sorry, there was a lady, I think Helene, I think her name was. She had a spinal cord stimulator. She did a trial thing that she said it really worked, but then when they put it in it didn't work anymore. So I think she had it removed, but you know, everybody's different. So
I think Glenn might be able to address that. I think a number of people have done well with the trial, and then when they've had it actually inserted, it doesn't last, and they eventually take it out. So I'm afraid that our experience has not been particularly positive, David. Glenn, do you want to say anything more?
Yeah, I mean, you're absolutely correct, by the way, about Helene and a few other people that come to the WNA support groups have had spinal cord stimulators implanted. The only one that I know of who seemed to do pretty well with it is Martin Price, who used to be a board of directors member at WNA, who sadly passed on last year. And he said that it really did help him. But most of the people that we've talked to, it seems to be a very hit or miss situation. And a lot of them didn't keep it in after a while simply because whatever effectiveness it originally had seemed to dissipate as time went on.
Does that answer your question, David?
Thank you.
Let me address the whole principle involved. The principle involved is that you've got signals that your brain interprets as unusual. And anything that you feel that comes from peripheral nervous system that seems not normal, seems different, your brain is going to automatically assume this means something's wrong. And the way that what the brain does in order to get your attention is to cause pain. And it doesn't really matter what the source is, whether it's a problem because the bee stung you or you cut yourself. Something's you're getting signals from your peripheral nervous system that says this is unusual. You shouldn't be there. And the brain wants you to do something about it. Well, when there's something goes wrong with the either the sensors or the nerves that carry those sensory signals, that shows up in the brain as something unusual, and the brain says do something about it, and it causes pain to get your attention. There are lots and lots of things. Have you tried using a TENS unit or creams, capsaicin creams, things like that? What those things do is they add alternative signals to the same part of the body, but you know they're safe. You know that there's no danger involved. And the brain can learn to say, oh, well, maybe since I can't do anything about these signals and I still seem to be walking and I still seem to be functioning, maybe I should relax. Maybe I should relax a little bit about this whole thing. Well, what a spinal cord stimulator, it's just an elaborate way of doing the same thing. It's adding a signal to your brain that you know is safe. And that's the principle behind a spinal cord stimulator, is to add a signal that you know is safe, and it gets the brain's attention and takes your attention away from these signals you're getting from because of the disease that you're getting from peripheral neuropathy. And so it makes sense that when you first try it, spinal cord stimulator, it makes sense that it would do what on a constant basis what a TENS unit or a capsaicin cream might do. It takes your attention away from your toes or wherever the pain is, seems to be coming from, and sends it somewhere else, somewhere safe.
The doctor said it might help me with back pain also.
Well, again, the back pain, most of us have, once you get a certain age, your spine tends to get a little bit damaged, and yeah, it can, for the same reason, let you calm down about it, because your back's not likely to go poof and evaporate. Your spine is still there. That doesn't mean the back pain goes away completely, but the same principle is in place. That is, Yes, it doesn't feel like the way it used to, but calm down.
All right. Thank you, Mike, for your observations. Do we have any other comments you would like to make, David, or shall we move on to another attendee?
You can move on. Thank you.
All right. Anyone else here today new who would like to introduce themselves to the group and or ask a question? Okay.
Got quiet. I would just ask David, because I threw something about this into the chat.
Brent Wilcox has got his hand raised.
Wait. Let Glenn finish, please.
David, what type of supplementation have you tried? Particularly people with diabetic neuropathy usually should at least take a shot at a trial of lipoic acid.
I haven't tried that. I do take a vitamin B12 supplement just because I'm vegetarian, and that's always recommended for them.
Yeah.
I've tried the cannabis cream, and it didn't seem to make a difference for me.
Do you want to talk, Glenn, quickly about our lipoic acids since he's not taking it?
Yeah, I mean, the most common and apparently overall effective for diabetic neuropathy in terms of supplements is lipoic acid in both the alpha and R forms. This is actually a substance that the body produces in small amounts by itself, but usually not enough to have an effect on nerve damage. It is an acid. It's also a very, very good blood sugar regulator. So people who do start trials of it should actually consult with endocrinologists, especially if they're on metformin or any of the other drugs, because you don't want your blood sugar to go too low. But this is a substance that, while it's available over the counter in US and Canada, it's actually a prescription medication in most of Europe. And it basically works by stabilizing the actual cell membranes. Some people take alpha lipoic acid and do well with it, but it is an acid. It can cause reflux in sensitive people. So there is also an R lipoic form, which involves the right-sided molecular isomers of lipoic acid, which are the ones that are active in the body. And that formulation came about so that people could take less of it for a given effect. Usually ratios of 6:1 to 10:1 are actually mentioned. So I went, for example, from 600 milligrams of alpha down to 100 of R for the same general effect.
Excellent. Thank you. Phil, your turn, please. Your hand is up. Phil Wilcox.
Oh, I'm sorry. My name is Brent.
I'm sorry, Brent. Brent Wilcox.
Yeah, I have my PN is idiopathic, and it comes from my mother's family, and all of my mother's aunts and her mother had PN of some nature. They just called it stinging feet and didn't let it go at that. Mine is pretty well advanced. It's up to almost my knees. I'm 73 years old, so I probably won't see it go much higher. I had a neurologist tell me, well, who's the oldest member of your family that has this and how far has it progressed? And sure enough, it was my mother, who was alive at the time, and it hasn't gone any further than that. But it has started to appear in my fingers, which is kind of concerning because I like to do woodwork. But I think it was Glenn who turned me on to lipoic-R, and that has helped a lot. I also take a B1, a B6, a B12, as well as a few other things. I'm a type 2 diabetic on top of all that. Well controlled. My blood sugar is never out of range for me. But when it gets really bad, though, I take Lyrica through the day. That helps a lot. And when it gets really bad, though, there's only one or two things I can do, and that is the lidocaine patches will come in handy. I've also discovered carbamazepine as a way to take care of some of the really bad pains. But you know what really kills me is that knife in the middle of my left foot. right on the top. It just drives me crazy, and it will last 2 full days, day and night. So there's no sleep. That's kind of concerning too. I don't have very many places to go, and I'm only 73, so it doesn't really hinder my activity, except for the fact that I can't sleep when it happens. I have tried opiates, and they just cloud the day. I stay away from them. I don't like them at all, but it does tend to cloud the pain in my foot. And then all of a sudden it will go away. And all I have left is a little bit of tingling, and I live fine with that. So I'm kind of a basket case, I suppose.
Thank you, Brent. Unfortunately, many of us know exactly what you're talking about. Stretching and searching as much as you are for that's part of the value of these support groups is sharing. And if anybody has anything else they would like to suggest to Brent, please raise your hand. I would also like to say that Glenn just put up that there was a prior webinar on the Nervo spinal cord stimulator that is available on their website and on their YouTube channel, sorry, and that's in the chat. If you click on it, I've realized that sometimes it starts playing and all of a sudden everybody in the group is hearing it. So either copy and paste the website, the YouTube, or just go to youtube.com and search Western neuropathy and check spinal cord stimulator. All right, I think now maybe I meant Phil Church.
Let me just comment on Brent. Do you take something to try to help you sleep? Brent? You're muted.
Yeah, you're muted.
Muted, Brent.
Got it.
I take a gummy to help me sleep, which really helps a lot.
Melatonin?
No, it's a cannabis-based gummy.
Okay.
I wanted to mention
trazodone, and trazodone helps me.
2 people talking. Mike?
I take trazodone, and trazodone, just 1, sometimes 2 trazodone, and that helps me a lot.
Is that a prescription? Mike? Is that a prescription, trazodone?
Yeah, it's a prescription, yeah.
Okay, so people might.
But they'll prescribe it to you just for sleep.
All right. And you could put that in the chat, please, so people know how to spell it correctly.
Okay.
Meredith, your turn, please.
I just wanted to mention in reference to the previous speaker that I still haven't been able to try naltrexone yet, but I thought maybe Glenn might want to mention it to David.
We can certainly talk a little bit about it. It's certainly in vogue now in neuropathy pain relief circles. Low-dose naltrexone is a compounded drug that basically takes naltrexone, which is an opioid antagonist and is actually used to help people recover from opioid addiction, and titrates it down to about 1/100th of the dose or so for that. We've certainly had a number of people at WNA who've had decent results with it. In fact, Sam Fields, who has neuropathic itch, says it's the only thing that's helped her with that. So the problem, I think, in actually talking about it is while you can point to an awful lot of literature on it, and there is even a low-dose naltrexone foundation in Great Britain, a lot of doctors haven't heard about it. So it's the kind of thing you really have to advocate for. And it is something that you have to get through a compounding pharmacy, a specialty pharmacy.
But David, people talk about in these various groups, little or no side effects. And it doesn't sound like it's real strong, like it's sort of the opposite of opiates and all. So might be worth trying at some point. I'm trying to find, I'm running into just what Glenn said, doctors don't seem to know a lot about it, so.
Excellent. Glenn or Meredith, would you again, please put it in the chat? It's always important for people to know how to spell the drugs correctly if they're going to research it. Thank you. Phil
I'll
Church.
throw in the Cornell Weil material on it.
Excellent. Phil Church, do you wish to introduce yourself?
Yeah, my name is Phil Church. I live in Fairfax. I'm 76. I was diagnosed with peripheral neuropathy about 5 years ago, I'd guess. And I've been lucky in that I don't have any pain, pins or needles or numbness. My problem is lightheadedness verging on dizziness. And the only solution I've found so far is where using a cane helps prevent stumbling or falling down. But I'm just curious if anybody else here in this group has had that as a primary symptom and what they did about it, and if they found anything that helped.
Wow, that's
No.
fairly new to me as the primary.
Yeah, it sounds like a dysautonomia, actually.
A what?
A dysautonomia. People can have motor symptoms, sensory symptoms, and autonomic symptoms from neuropathy. Your autonomic system, your balance, your blood pressure, your digestive and elimination systems can all be affected, particularly with people who have a major small fiber component to their neuropathies. And there are a number of medications that are sometimes used for that, but sometimes it can be just as simple as having a higher salt diet. Although if you also have high blood pressure as a condition, that can be dicey too. I'll also put in, I just threw in the naltrexone stuff. I'll put in the Dysautonomia Society stuff as well. So you can take a look and see if any of that matches up to what you're experiencing.
Thank you. The only drug I'm taking is vitamin B supplements, but that doesn't seem to have done much, or at least I didn't notice it if it did.
Thank you, Glenn. That sounds helpful.
Very often dizziness is caused by inner ear problems. Have you had anybody test you for inner ear problems?
Yeah, I did have that checked and they're okay.
Okay, thank you. Janice, your hand is up. Janice Greif.
Here I am. I have a question about the low dose naltrexone. I've read on the internet, rightly or wrongly, that you can't take opioids if you're on it.
Right.
So is there a real concern that if something happens that puts you in terrible, terrible pain, you're very disadvantaged because you're on low dose naltrexone?
You'd probably just have to come off the low dose naltrexone. Hopefully that wouldn't happen to you because generally opioids are not a first line treatment for neuropathy. Opioids, maybe if they were being diagnosed for, say, cancer pain or severe bone breaks, then I'm pretty sure they would wean you down very quickly off the low dose naltrexone. Fortunately, that's not a long process, unlike some of the other PN drugs.
What if, unfortunately, I'm a catastrophizer, so I thought of this. What if you're in an accident, God forbid, and you're in agony? What happens? How does that change how you're treated in the emergency room?
Depends on the extent of the injuries, I would imagine. They might put you on opioids. There are things they can try before opioids. I guess what you'd have to do is either be lucid enough or have someone to advocate for you in such a situation to say, wait a minute, this person's on low dose naltrexone. So we have to take that into account.
Mm-hmm.
Are opioids dangerous? One article gave the impression that it's really dangerous to be put on the opioids.
They can be. I mean, certainly you're familiar with the street opioids that are out there, things like, oxycodone and heroin.
I'm sorry, I'm asking if they're dangerous when you're on, more dangerous because you're on the low dose naltrexone.
Well, they would antagonize each other. You can have some very, very bad reactions. Yes, you do not want to be on both of them at the same time.
Okay, thanks.
Okay, Janice, thank you. Marlene's hand is up. Marlene?
Maybe Glenn, you could address this. On all my labs that come back, my B12 is always pretty high. Should I still be taking it then?
Well, if you're supplementing, I'm not surprised.
I'm not supplementing.
You're not? You're not taking anything with B12 in it?
No, because mine was so high on the labs, I didn't know if I should still be taking it.
Well, okay, but how long ago did you stop taking it?
Oh, well, it's been a while, but I had my labs done twice and this came back.
And how far high was it? Most of the lab.
Yeah.
I
don't have the number in front of me, but it was pretty high. Yeah.
I mean, most of the lab results that are out there range from the 200s to the 900s deciliter. figures, although in Japan and Europe, the actual floor is about 550. They actually think something in the 200, 300, 400s is too low.
So should I still try to take it then?
You might not have to. The only condition I know of that results sometimes in higher B12 levels involves lysing of red blood cells, which means you might have exploding red blood cells there, but that would be something in the rest of your labs that wouldn't be hard to spot. It may just be that you still have pretty good B12 storage, because B12 is one of the few B vitamins that actually gets stored in the liver and can be released over time. It's certainly worth like investigating with a hematologist if you can get that appointment.
Excellent.
Well, when I see my neurologist in November, I'll ask him about it.
Yeah, I mean, most of the time, high B12 is due to supplementation. And I've actually had to explain to technicians on several occasions why my level is so high.
Well,
Mike, your hand is up.
What in the body, can you get all the B12 you need from food?
You can, but it has to be animal products. Unfortunately, we're not cows, and we do not synthesize B12 in our, midgut like, some of the herbivores do. It's one of, by the way, I hate to say this, it's one of the best arguments against human vegetarianism. You can certainly be a vegetarian as a human, but as was mentioned before, you have to supplement with B12 if you are.
Interesting.
No,
Okay.
you won't get, you're gonna get it from, so it only comes from meat products.
Well, and dairy.
Yogurt and.
Yeah. If you're ovo-lacto, you should be able to get enough.
Oh.
But yeah, true vegans, and I've had this discussion with true vegans a lot. You definitely need a B12 supplement.
Okay. Judson wrote in the chat about Medinex. And would you like to add anything, or David might look at it? It says he has arrested his stabbing foot pain using a food supplement called Medinex. And Go ahead.
Yeah, I call it Meta-NX. It's doctor prescribed. It doesn't seem to work for everybody, but boy, it sure worked for me. I consider it a miracle cure. Now, Glenn is going to tell you that you can get it a whole lot cheaper if you just go to the store and buy the individual ingredients and mix your own. And that's probably true, but I'm not a chemist, and so I pay the piper. And it is completely stopped my neuropathic pain from, I would say, an 8 or a 9 down to a 1 to a 2. I take no other painkillers. I was listening to Brent's description of what he takes, and I don't do any of that. It basically is. It has just stopped the pain, and if it works, it works. And Glenn talked about alpha lipoic and mylated and vitamin B, and that's basically what it is. So we're talking in the same street, I think. But this is doctor prescribed, doesn't work for everybody. It's got a lot of caveats, I mean, I would try. It's slow to ramp up. You have to take it sometimes 2 or 3 months. It's called Meta-NX. Meta-NX, just the letter N, letter X. But you have to get it through a doctor. I get it through my podiatrist who prescribes it for me, and I get it on the internet. It's very expensive at the drugstore. It's less expensive through. I got my brand health pharmacy. It's a mail order pharmacy, reputable. In this group, a lot we talk about is making sure that your amounts and the quality and so forth of the drugs you're taking, especially over the internet, are, well regulated. And I do feel like that about this drug. It's not homebrew at all. It's not homeopathic. It's none of that. It's not new age in any way. It's just a compounding of various drugs in a capsule form. So I'll throw that out there.
Okay, thank you. Heather Putnam, would you like to offer any comments or questions?
Can you hear me?
Yes, we can.
I'm Heather Putnam. I'm from south of Boston. And the reason I'm listening to you is because Weston, Massachusetts has a group, but they meet like at 7 o'clock at night. And I'm not about to drive to Weston, Mass at my age at 7 o'clock at night.
Sure.
So I happened to see this. Just a couple of things. I have neuropathy from spinal stenosis, particularly problems with my feet. But I've done a lot to improve it. And I just was really interested in your speaker with acupuncture. I just came back from Ireland. I led a group to Ireland, 11 family members. And I thought, how am I going to do this? And I did PT all winter, and then I hired a personal trainer. And then I've been doing acupuncture. And I found that the acupuncture has really helped a lot. It's not covered by my insurance, by my Medicare plan, so it's expensive. I did it once a week. And one of the things he told me to do, and I've been really religious about it, my feet were really bothering me last night. You know, you're talking about all these, he said, hot water and Epsom salts. And so it's like $3 at the pharmacy. So you do that, and then you rub on whatever cream you might like. But the whole key is the Epsom salt, and that came from the acupuncturist, which I found fascinating. And
Mine
so
said the same thing.
I did, and I've been doing that, and it makes a difference. I mean, it really does make a difference. My problem is at night and in balance and walking. And at this point, when the older you get, the more you say, I don't give a toot who sees what. So now when I take a real long walk to steady myself, I use poles, one on either side, and I just pull through it.
Yeah. Excellent.
My acupuncturist said the same thing, by the way, Heather.
Really, yeah, it works, and the acupuncture does work because my man is Chinese. And he's very, very good. And he talks about getting the flow in your toes, the flow in your feet from this.
Right.
And I can see this when I come home. I can see the pinkness returning to my toes. Now, the other thing he said was Tai Chi. And I don't know if any of you here belong to the Council on Aging, but I do, and they don't charge anything for Tai Chi. They do Tai Chi, they do Qigong, whatever. I haven't done that. They do all kinds of things. So if you have something like this near you, it really is worth investigating. As you say, you've got to try different modalities to see what might work.
I think this is such an individualized disease. Someone
at
another meeting said, oh, if I put my feet in hot water, I'd be in so much trouble. I have to plunge them in ice water. So it really is finding out what works for you. Glenn, I'm a little confused. What is the reference to Weston, Massachusetts?
I put that in for Heather because you were talking about going actually out in person, but Leslie McGregor also does an online support group that is actually affiliated with her in Massachusetts General, and they meet on Zoom Thursday afternoons, third Thursday of each month.
They meet through the Mass General?
Yeah, but it's an online support group. They're affiliated with Mass General. Leslie McGregor is also on the board of directors of the Neuropathy Action Foundation.
And they meet on Thursdays?
Yeah.
But only once a month?
Right, third Thursday, 1 to 3.
I joined this group only because I wanted to hear what other people were saying. You know, what have you tried? It's been fascinating to me just sitting back and listening to each one of you, and how's your journey been? It's no fun.
No, it isn't. We always recommend that people save the chat if you're able to do that. Usually if you find it under more with the 3 dots, the ellipsis, and it says notes or whatever, but some work on your laptop, but not on your
iPad.
tablet or your iPad. So if you don't save it, we always save it and try to post it to our website as well, because there are so many references made. And that's why we asked people to put it in the chat, and why I questioned Glenn what the reference was to Weston. So thank you for putting that up. We have a couple of minutes before we go to wrap up. If anyone else would like to speak.
There's a question in the chat from David. How do Epsom salts work? Glenn, you have any opinion about that?
Yeah, it's actually ionic chemistry, which unfortunately is my bailiwick, so I won't try and be too complex with it. Most of the functioning of the peripheral nervous system is chemical electric. You guys probably know that you have to have a certain amount of sodium, calcium, magnesium, and potassium in your diet, because these are all elements that in ionic form actually regulate the transmission of signals up and down nerve fibers. Epsom salts usually have a high magnesium component, and if they can actually get past the skin barrier, they can enhance the nerve signaling. It's pretty much for the same reasons that people take magnesium supplements, or some people do things like the Rebuilder, which is also done with like warm water in a magnesium ion solution.
I found this wonderful product called TheraWorks, with THERA, but WORX, that you spray on, and it immediately resolves the leg cramp. If you wake up in the middle of the night and you jump out of bed and you say, you try to walk it off or walk around, if you spray it with this, it really, really helps. So I should put that in the chat. I've had very positive experience. Anyone else before we go to wrap up?
Question, Glenn. What is she's talking, Pat's talking about these leg cramps. What is a cramp? What causes it? What is the nature of it?
It's basically an erroneous nerve signal that tells a muscle to contract when it's not doing work that would necessitate the contraction. It's definitely a feature of neuropathy, because you get those erroneous nerve signals coming down. Fortunately for most people, they're transient, but yeah, you can definitely have them be extremely painful and be sore for a while afterwards. There are unfortunately some people who experience almost constant cramping and spasming, and who may need much stronger things than magnesium to address them.
Because years ago, there were a lot of recommendations to take vinegar to stop cramps, and I was religious at it for a while, except that it turns out that part of my religion is having cramps, and they kept right on going.
I've heard pickle juice as well.
I took pickle juice for a long time.
Yeah, all these things have very heavy mineral components to them.
But I was happy to hear that Rebecca felt that Dr. Orit had helped her with her cramps. So there's another plus for acupuncture, at least a trial of it. I tried to quickly look up what the cost would be for this Tai Chi that Dr. Orit is offering. And I found that, unfortunately, the contact information she put in takes you to a larger website, and it doesn't specify her, so you have to do more searching. So I couldn't find it quickly. Maybe while I do the wrap up, someone could check her, Rebecca, check her website, the, what is it, True Health Clinic Foundation.
True North.
And see if you could, True North, sorry, if you could see anything more detail about what the cost will be. And she did say she will only do it if she has a minimum of 5 people sign up. Of course, that's not just our group, but 5 people.
Okay, well, what I got was 4-week series starting on Tuesdays at 10 o'clock, October 21 to November 11. It's $125, or early bird rate is $105 if you register by 10/13.
Okay, if you could copy that and put it in the chat, that would be helpful, because
I thought I already did.
No, people put the True North website up, but I could not find the price. Well, I don't know where you found that, but that was helpful. Okay, all right, I'm going to go ahead, and if you will, Mike or Judd, pull up the wrap up slide. closing remarks? Again, I put this up because you might want to just take your camera and snap a picture, because it'll take a while for it to get on our website, if that will help you remember days and times. While we're waiting, Heather, were you talking about the National Council on Aging? Is that what you were suggesting that people join?
I do. I have a usually in Massachusetts, each town. Can you hear me?
Yes.
Oh,
Yes.
each town has a council on aging.
Uh-huh.
And Milton has one. Milton, Massachusetts, very, very good. And they offer all kinds of exercise classes, chair yoga, Tai Chi, etc. Usually there's no charge, or they might charge $5 for a class. But you know, to combine that with, say, paying for the acupuncture, you have to use a bunch of modalities. And this is one of the best bargains around, is a council on aging, if there's one near you.
Well, thank you for that reference. Good job. All right, I'm just going to quickly go through some of these references of days and times of alternate support groups. Of course, ours is always the first Saturday of the month, so we will meet on November 1st, and we will not have a speaker. It will be totally devoted to open discussion, so please record that if you're interested. And if you go to our website, pnsnetwork.org, you can join, and when you join, it's free, and you are automatically added to the, you are automatically added to our mailing lists and will receive all future invitations. The Bethesda Chevy Chase group is facing a transition. Steve Klitzman, who ran it for a couple of years, has decided that he needs to take a break due to personal health concerns. So we are trying to keep the Maryland group running as well via Zoom. They meet on the third Thursday of the month, and it's in the evening, if an evening meeting works for you better than a Saturday afternoon. And it also will be open discussion. Next slide. Okay. Western Neuropathy Association, I'm always admire the effort that this group puts in. They have various groups with different topics, like chemo-induced, or a group for singles with alternating days and times. So if you want a list of all of the possibilities, you can go to pnhelp.org for the details. I'd also like to mention that they have recently posted a recording of their, I think it was the September webinar on Bowen therapy, and I'll let Glenn talk about that because it's now on YouTube. Glenn?
Yes, we had a practitioner of Bowen therapy, which is related to a number of other gentle massage and myofascial techniques, come on and talk about how that might be useful for people suffering from neuropathy. It is both on the website, and if you go to the website at pnhelp.org, you can get onto our YouTube channel, where that is not only posted, but all our webinars get posted, and there's several dozen on there, so you can go and look through them. This month's webinar, we normally hold them, by the way, on the fourth Thursday of the month at 4 p.m. Eastern, is not set yet, but it's probably going to be an occupational therapy webinar on fall prevention. So it'll involve equipment and non-equipment ways of maintaining balance. The other thing that's happening, since we do so many online groups, specialized or not, we've just added one for October. It's on October 24th, the fourth Friday, is going to be our first online support group on people with autonomic symptoms. We were talking about dysautonomia before, so this might be very appropriate for people whose major symptoms are autonomic in nature, or who suffer with a lot of autonomic symptoms. So that makes the 8th online support group we have, in addition to the 2 remaining in-person ones. But just go to pnhelp.org and look at the calendar, and also all the other information that's there as well.
Remind us where the in-person ones are still.
One's in Carmel, California, and one meets every 3 months in Houston.
Okay. And the webinars on the fourth Thursday at 4 o'clock?
Yes.
4 p.m. Eastern time.
Eastern, yes, Eastern Daylight Time still.
Okay, good.
Come November, it'll be back to standard.
Excellent. And now moving to the Foundation for Peripheral Neuropathy. They also have a webinar coming up on October 22nd at 3 p.m. Eastern Time. You can find more information on their website, Foundation for Peripheral Neuropathy. But the topic is regaining your balance, therapy and exercise for PN management. So it sounds like it sort of segues with your occupational therapy fall prevention. I think we're all very concerned about falling. Michael Foxworth always says, it's not the PN that will kill you, it's the fall when you end up in the hospital and then get your lung issues, et cetera, et cetera. So that is regaining your balance on October 22nd. I also want to remind people about the magazine called Brain and Life, and it is both a print magazine if you join. It's also online. And I didn't realize it, but they are now introducing a podcast, brainandlife.org/podcast, that you can subscribe to and or join. They have real person stories and information sharing somewhat like this. So that was new to me, and I thought I would mention it to you as well. We also want to say a huge thank you to those of you who, I should have said this earlier before people started leaving, a huge thank you to those who offered help in trying to keep our two groups going, the DC, Virginia, and the Bethesda, Maryland groups. If you have not been contacted by us, it doesn't mean we don't want you. It just means we haven't had time to reach out to you to try and figure out what type of assistance you might offer. Many people said, I can do things, but I'm not a techie. Don't worry, we can help you. There are so many other non-techie things that need to be done. So again, I appreciate any offers of help, and we will be in touch with you. And I think that leads us right on time at 3:59 to overtime.
Exit survey.
And yeah, oh yeah, sorry, that's important. Please complete the exit survey. That was the last thing on the slide. And these exit surveys are really quick, 3 questions usually. At the end, when you end your Zoom session, it will pop up automatically. It asks basically what you learned from today, what your takeaways were, what topics you'd like to see considered in the future. So we use that to guide our discussions about what programs to offer. So please take a minute and fill out the form. I see there are 8 new messages in chat. Is there anybody checking that? Is there anything that hasn't been answered? Goodness.
David put a question in here. He wanted to know what we thought of nirvana. I think it's the same thing as alpha lipoic acid, if I have kind of a vague memory.
Yeah, I think it's mostly lipoic.
And David also noted that there is a Montgomery County Department of Recreation that offers Tai Chi. So that's helpful for those of you in Maryland. And I think that is.
So if you did volunteer and you're concerned about your technical skills, I simply point out that Rebecca and Pat do not consider themselves technical, and the 2 old guys who act like they think they know something about technology. Well, there was a time, you know.
Yeah, there was a time.
Yeah. Okay.
Hey,
we're going to. Oh, Chuck, question.
I just wanted to share something in overtime.
Oh, okay. We are now going to move. I earlier talked about overtime. This is your opportunity to be in a more social setting. It is not recorded. If you have a follow-up question or you want to talk directly with someone that you met today, please join us. We keep it on until 4:30. So that's an additional half hour if you want further time to talk to someone. Chuck, would you like to?
I'd just like to talk about, if you don't mind, my experience.
Excuse me, can we stop the recording?